I'm Deborah Servetnick. I was diagnosed with stage 3 breast cancer in 2011. And the thing about breast cancer is it's different than some other cancers because you don't have any pain, you don't have any real symptoms, and you just go for this mammogram and then you find out you have cancer. So the feeling sick part never really hits you until the chemo and the surgery and the radiation. And then it's like a Mack truck. So everything hit me all at once. And I remember crawling from my bed to the bathroom. I couldn't stand up. My hands were like this after chemo. I had sores all over my body, from my head to my toes. And I couldn't finish a sentence. And really, I couldn't finish a sentence until 2017, since I had chemo. Much better now. It took a long time, and I attribute that, one of the things I attribute that to is cannabis, for sure. So I had a friend of mine in California who had HIV, so for years, and cannabis was part of his repertoire, in his healing repertoire. And he would send me things from California. And it was through him sending things that I actually started to get better. He would send me tinctures, and I would just try to find out where I could get more of these, and it's just so difficult to get them. And I went to Annapolis to testify because it was so important to me. It became so important. And I remember hearing Charlotte Figge's mother speak the day I was there. And I remember thinking that I'm going to work in a dispensary. That's what's going to happen. And I'm going to really help people that really need this. Because after bilateral mastectomy, and then after a reconstruction, and then after probably 5 or 6 revisions, I just couldn't get better. I spent a year in bed. I missed a year of work. Took a toll on my family. And when I finally started treating with cannabis, things started to change. So because I was gluten-free, and I was gluten-free because of the number that chemo did to my stomach. It destroyed my stomach, and of course the opioids that I was given, which they would give me anything, but I never wanted to take them because I always had severe stomach pain from them. But I had all of them. I had hydrocodone, hydromorphone, I had Klonopin, I had Ativan, I had everything because I was so miserable, I wanted to die. And my daughter knew I wanted to die, and that's when I knew it was really bad, and I knew I had to do something. So I just really got off chemo and told my doctor I was going to get better anyhow. And I did, through cannabis. And it was a life changer. So when I found out that the dispensary I work in was coming to my neighborhood and people were angry about it, I made sure I went over there. And I said to them, I'm so grateful you're coming, because I was sure I'd have to drive like an hour to a dispensary. And I remember the days that I couldn't walk and I couldn't stand up. And I couldn't do any of that. And I had to lean against a wall if I went from room to room. And when I went back to work as a teacher, I had 3 chairs in my room because I couldn't make it across even my classroom. And when we had a fire drill, I fainted. And I couldn't do it. I was so weak from all that. But when I went to this meeting, I told them that, I guess it made a difference because I'm working at a dispensary. I'm coaching, life coaching, and cannabis coaching and health coaching there at a dispensary in Baltimore. And it's just the most wonderful feeling to know I can help people feel better, even when medicine seems good, treatment seems good, the doctor's right there too, but there's just something that's missing, and they're not getting better. It's cannabis.